Over the semester, it's been very difficult to find an internship somewhere in the medical field, so I had to use my resources to fulfill my interests. Over the semester, I did multiple things to learn about the medical field, like I learned how to insert an IV, I took practice ACLS and PLS practice tests, which are the exams that nurses have to take to renew their license, and I toured the new Marina Health Medical Center and talked with multiple doctors and nurses about their work. Today, I'm going to show you about how to insert an IV, but because some people are squeamish around blood and needles, I'll be performing a realistic parody of the inserting of an IV into a towel. First, we have the arm towel, which we must put a tourniquet around so that we can find a vein. And then we can put on our gloves. Then we rub the area for about 20 seconds with an alcohol swab to clean the area. If a patient was a child or if they were particularly sensitive, we would have applied this numbing cream 20 minutes before the insertion of the IV. The next step is to open the needle and take off the safety guard. We then insert the 20 gauge angiocath IV into the vein and advance until you get blood, and then you press the white button down to retract the needle. You would then attach the required tubing for the IV, however, we didn't have any tubing to use in this demonstration. You apply bandages and tape to keep the IV in place, and then you have successfully inserted the IV. Here is what the PLS practice test looks like. I'm going to show a couple of clips of a BLS, a basic life support practice test, which is part of the ACLS.
Hello, can you hear me? There was no response.
There's no normal breathing or pulse.
So every 2 years, my mom has to take this test, and every 2 years, I give it my best go at the practice tests. This year, because I've been trying to learn so much just on my own, I actually was able to cure a baby who was in cardiac arrest through one of these simulators, and I did it all by myself, and so I was really excited that I did that this semester. With each phone call and email I wrote to potential placements, I was shut down because they were high-risk environments that weren't accepting any extra staff. This was frustrating, but many places told me that come January, they will hopefully be accepting interns. I do have a potential internship with an emergency room doctor at Marina Health Medical Center. However, I'm waiting on the okay from the Department of Education, who hasn't yet approved interns after the shutdowns.